Hello, my name is Salman AlJerdi. I'm an assistant professor of neurology at Weill Cornell Medicine-Qatar. June is Alzheimer and Brain Awareness Month, and I wanted to talk to you about Alzheimer's disease. Dementia is a very common condition around the world. In fact, an estimated 50 million people globally live with dementia, although this number is significantly an understatement. Out of these 50 million people, 60 to 70% are estimated to have Alzheimer's disease. Alzheimer's disease has been on the rise in addition to dementia, generally due to an increase in population in addition to our population surviving and living longer. While this is good news, an aging population that is struggling with dementia can be a very challenging condition. Alzheimer's disease is a very difficult condition to manage. It typically not only affects the patient, but the entire family of the patient, because they are typically caregivers of the patient. It also usually requires significant resources that may be out of reach for the patient and require government assistance to provide. Alzheimer's disease, as previously mentioned, is the most common cause of dementia. It typically starts in the late 60s or early 70s part of life, and it usually starts in the early phase with some dysfunction in short-term memory, in addition to visual spatial dysfunction. That manifests itself as getting lost in familiar territory, such as coming back from work. Often in the beginning of the disease, patients are able to live independently. However, as the disease progresses, they are no longer able to perform their activities of daily living and often require assistance and eventually 24-hour supervision. While the exact mechanism of Alzheimer's disease remains unknown, several theories have attempted to explain how Alzheimer's disease happens. The first has to do with amyloid. An abnormal breakdown product of amyloid, known as amyloid beta 42, is a protein that aggregates abnormally outside of cells. This can cause something called plaques, and the plaques interfere with the communication between neurons. In addition to this, another theory incorporates tau. Tau is an important protein with the transmission of vesicles that have neurotransmitter within the cell body of the neuron. Tau may abnormally aggregate and form something known as neurofibrillary tangles. This will prevent the normal transmission of these vesicles within the body of the neuron, thus affecting memory and other functions of the brain. If your patient presents with memory loss, or for some other reason you suspect Alzheimer's disease, it's important to begin by obtaining a good history. This is to establish whether the patient only suffers with memory loss or if they have other forms of cognitive dysfunction. A physical examination, particularly a neurological examination, is important to rule out focal neurological deficits, which may imply another cause for this patient's symptoms. Afterwards, proceeding with formal cognitive testing, whether using the Montreal Cognitive Assessment or MoCA, or the Mini Mental Status Examination, is important to quantify this patient's deficit. This is typically followed by blood work, including measuring levels of vitamin B12, folate, thyroid function, and syphilis testing, in addition to neuroimaging to rule out structural causes of this patient's symptoms. After all of this, the patient should typically be referred to a memory center where experts in handling Alzheimer's disease will be able to see and evaluate the patient. Once Alzheimer's disease is diagnosed, there are several pharmacological and non-pharmacological treatments that can be used, both of which are significantly important. For pharmacological disease treatment, it depends on the phase of the illness. So for mild to moderate Alzheimer's disease, we typically use a class of medications known as acetylcholinesterase inhibitors. And an example of this would be donepezil. The others will be listed. Other medications that may be used as the disease progresses include memantine. These medications work on the NMDA receptor. Newer medications such as aducanumab have been approved by the FDA. However, the efficacy and safety of these medications remain in question, and the utility in everyday life is still being determined. The cost may also be prohibitive. Non-pharmacological treatments of Alzheimer's disease typically include a multidisciplinary team approach between the treating physician, in addition to the occupational therapist, physical therapist, and speech and language pathologist. The combination of these skills is optimally required to provide the best care for the patient. It is important to educate ourselves and our patients about how to manage and how to prevent Alzheimer's disease. Alzheimer's disease has non-modifiable risk factors, including age and some genetics, But other modifiable risk factors include hypertension, diabetes, and obesity. It's important to encourage patients to engage in educational and mentally stimulating activities for a very long period of time, in addition to encouraging healthy exercise. A diet that is low in sugar and rich in healthy fats, such as the Mediterranean diet, is also recommended. In summary, Alzheimer's disease is a serious and prevalent neurodegenerative condition that is difficult to manage. Early recognition, in addition to a multidisciplinary team approach, typically preceded by very aggressive preventative measures, is the best way to approach Alzheimer's disease as research continues to produce more promising results for future treatments.